Good evening, everyone. Thank you for joining. Appreciate your patience. It looks like there's still some folks kind of joining, and so we are admitting everyone. We will get started here shortly. Okay, so we have about 9 RAC members already on the call. Uh, Jen and Regina really defer to you all if you'd like to wait another moment or kind of get things started.
I think we can go ahead and get things started because we'll have some introductory slides and a little bit of information that we'll share first. So that'll give people a little bit more time. So I guess I will start out by introducing myself. Good evening, everyone. My name is Jen Eras. I'm the lead childcare assistance policy analyst for DELC. So I primarily work on the ERDC program and a couple other little childcare programs that came along with us. And I will pass it over to Alma.
Good afternoon. My name is Alma Amador, and I am a policy analyst with the Child Care Assistance Program at DELC. Reggie?
Good evening, everyone. My name is Regina Seifert. I am also a childcare policy analyst for ERDC.
All
Hi,
right.
everyone. Oh, sorry.
Sorry. No, go ahead.
Kathy Way, and hi, everyone. I'm the DELC Rules and Legislative Coordinator, and great to see everyone.
My name is Melly Bukowski Reyes, and I'm an early child care provider, coach, trainer. Yeah, you know the hats. And I'm representing families.
I can go ahead and call on people just so it'll make it a little bit easier for introductions. So Amy, would you like to introduce yourself?
Sure. My name is Amy Hanna, and I am a registered in-home family provider.
And then the next on my screen is Jill.
Hi, I'm Jill Johnson, and I run a young parent program and a childcare facility that's license exempt in the 4J school district.
And then Jennifer.
I am the manager for the Child Care Resource Referral and the Every Child Belongs grant in Umatilla Union and Morrow counties.
And then Molly.
Hi, Molly McLaughlin. I work for Southern Oregon Early Learning Services Hub serving Jackson, Josephine County.
Okay, and then Gabby, if you wouldn't mind introducing yourself.
Yeah, of course. Good evening, everyone. Gabby Hernandez, she, her pronouns. I'm the Early Learning Council Administrator here at DELC. Good to be here in the space with you all.
Okay, and then my pictures all kind of moved around a little bit, so I'm going to try and make sure I get everyone. Lisa, would you mind introducing yourself?
Hi, I'm Lisa Duffield. I'm a certified family provider and am here with CCPT Local 132.
Okay, and then Natasha.
I am Natasha. I work for 211 Info Childcare and I help families find childcare referrals.
Okay, it looks like we had someone else pop into the Teams meeting, so we'll have to grab them really quick. Kim, would you mind introducing yourself?
Sure. I am Kim Hewling, and I am with YMCA Child Care Center in Milton Freewater.
And then Marshall, would you mind introducing yourself?
Hey everyone, Marshall Kalikini. I use she, her pronouns. I'm the political director for All Families Oregon and a parent of two.
Wonderful. And then Annalise.
Everyone, Annalise Shahan, certified family in Clackamas County, and here with our union childcare providers together.
Okay, and then we have Advocacy Latino Network. I'm not sure who that is. Sorry.
I'm so sorry.
Oh,
I will
hi.
change my name.
No worries.
Hello, everybody. Mercedes Elizalde. I use she and her pronouns. I'm the advocacy director at Latino Network. So thank you very much.
Wonderful. Thank you all for joining us tonight. And I'm going to pass it over to Alma. She'll go through a few of our introductory slides on what to expect tonight.
Yes, thank you. Are you sharing the slides, Jen?
Yes. Can you all see my, oh, you can't see it, can you?
No, I see
Hold
one
on.
screen, but
Yeah, I can see your slides, Jen. I see the interpretation slide currently.
Okay, yes.
yeah, that's all I'm seeing.
Okay. Yes. And this is, yeah, so we'll just go over this on anyone who
Okay.
may need to access interpretation.
Okay. Oh, okay. Apologies. Okay.
Okay.
We have interpretation services available. We have a Spanish interpreter here. If you're needing to access that, here it gives you information on how to. Oh, I'm seeing a message from Gabby. How to access the links if you're by phone or if it gives you instructions on how to access that. If you need to, if you're having problems with interpretation, let us know during the presentation and we can troubleshoot that for you. Next slide, okay, and our agenda today. Just a few points here. We're going to have welcome and attendance. I think we already did this. We're going to review group norms. We're going to overview the proposed OER updates that are going to be effective March 1st of 2026. We're going to review the next steps and timeline, and then we're going to have time for some closing comments and thank yous. We are proposing rule changes. Well, for some rules on here, some group norms. We'd like to keep in mind that we want to bring an equity-driven perspective and approach. We'd like to center children, families, and early learning professionals. We'd like to stay curious and welcome other points of views. And we want to seek to understand then to be understood. Stay present, be respectful with your words. Let's be aware of the power and privilege within this group. And let's begin and stop on time, honoring everyone's time.
All righty, thank you all. So I'm going to go through, this looks a little overwhelming with an entire list, but we have about 10 different rules that we're proposing changes for that will be effective March 1st. About half of these are what we would call, essentially we're just cleaning up or tidying up the rules a little bit. Prior to July 2023, our rules were together with a lot of the different self-sufficiency programs over at the Oregon Department of Human Services. So you'll see some carryover language that actually belong to other programs, but since our rules were mixed together, some of that language just carried forward into our new rule set. And so we've been going through the last 2 years, trying to do some cleanup and just catching things where the words aren't quite right or there need to be some changes. We also have some pretty exciting changes that we'll be introducing with this rule set as well. So I'll make sure to call those out as far as whether it's more of a cleanup rule or if it's actually making some significant changes. And definitely feel free to raise your hand or let me know if you have any questions. I'll stop after each rule. So if there's anything you want to discuss or any concerns you have, we'd love to address that and love to hear your feedback. So we're starting out easy with this one. We're making some changes to some of the definitions in our definitions rule. Specifically, we're removing the the language custodial parent, and we're changing that to caretaker. So this is being done because the employment-related daycare program, anyone can actually apply for childcare for a child that they have, we consider it care and control over that child. Most of our families, they are parents that are the ones applying for ERDC. Sometimes we have grandparents or other relatives, but we don't have a requirement for the caretaker to actually be related to the child. And we don't have a requirement for that caretaker to have like legal guardianship over the child. So custodial parent really doesn't apply in our rule set. Pretty much all throughout the rule set, you'll see either parents or caretakers listed, but caretaker is a all-inclusive term that includes people who may or may not be related to the children as well as their parent. So we are changing that term. We're also adding some clarification to the term farmland. So specifically, this is in a piece of rule that's talking about income producing property. So property that creates income for the person who has it. So for farmland, we had to specify under this that this is only applying to farmland that is leased or rented in order to receive income. If a person is actually living on a farm and working it, that would be self-employment income. And so it's counted a little bit differently whether they're renting a property or whether they're actually working that to produce the income. So just want to open up my chat here so I'll be able to watch that too. And just checking if anyone has any questions or concerns about these changes. Okay. I promise we'll get into some more exciting ones here in a minute. All right. So with this rule, this is actually more cleanup. This is not exciting either. Essentially, with our rule set, we do have the reasons that a case could close in the middle of its certification. They were spread out through a few different rules, and that was making it really difficult for like some of our eligibility staff over at ODHS to be able to find it and just clearly understand when are those few scenarios that a case might be able to close in the middle of the certification. So what we did is we pulled those reasons all together and put them together in the rule titled certification period. So we figured that would make it very easy for staff to be able to find it and to see all of those together. We're hoping that that will help provide more consistency and better understanding for our staff that are accessing those rules. And so I don't see anything in the chat, just waiting to see. Thumbs up. Thank you so much. All right. Let's move on to the next one. This one is essentially changing the term caretaker relative to just say caretaker. Excuse me. A caretaker relative is a very specific term actually for the TANF cash assistance program. So the TANF program does require for a caretaker to be related to a child within a certain degree. And that's essentially what a caretaker relative is. As I've already explained with our program, we don't have that same requirement. So this was really just a carryover from our rules on the eligibility determination groups, how it had been held together with TANF and with other programs. So we essentially just have changed that, that term all throughout this rule. And I will just keep going unless I hear someone or see someone waving me down to stop.
I see no questions in the chat.
Thank you. So this rule, we're making some changes to the rule for establishing a childcare need and authorized hours. This one is actually a piece of rule language that we adopted last year, but because our rule schedule was so compacted together, we have a couple different rule change bundles that were happening back to back. And in those rule changes that happened back to back, we actually ended up losing that language in the next rule change bundle that went through in July. And you'll see another rule that was impacted by this as well. So we have some rules that, we changed them, and this one in particular, we changed it in March 2025, and then we made another change in July 2025. this has a lot of information in it, and a lot of it covers a lot of ground. So we don't always make all of those changes at the same time. But just with version control, we did inadvertently lose some language. So you'll see that in this language, we're putting back in those pieces that we talked about last year regarding distance learning. And there's one other rule where we had actually lost some language that we were adding back in. And actually, because of this, we're changing our rule change schedule so that this won't occur again. So we will primarily be having RACs in January, or for January rule changes, and for like June or July rule changes, but we won't be having that separate RAC for a set of March rule changes in the future. And then with this rule, this is actually a very exciting. Oh, sorry, Annalise, you had a question.
Yeah, on that last one, I just want to make sure on Rule 23, absolutely nothing is planned beyond just restoring that March 2025 language, correct?
That's correct, yes. And thank you for clarifying that.
We have a question from Natasha 211 Info. Is this adding distance learning to ERDC?
Well, the RAC for this was last year, but essentially what this was doing is it allows for a child to be to participate in distance learning if the reason that they're participating in distance learning has to do with their own like mental health or physical health concerns, or medical concerns for either a household member or like a relative that they have frequent contact with. This really came out of COVID era changes that we had. So we have a lot of multi-generational families where they may choose not to have their child attend school because they have medical concerns for people in their household. And so we just want to make sure that is something that's allowable for those families. The families are really, they're the experts on their own family. So we're letting them determine if that's a situation that's needed for them. So like I said, this had been put in place during COVID, and then we actually needed to add some clarification to it because essentially the previous rule language under the COVID rule said that it had to be for COVID related concerns. And we can't really use that language anymore. So we had changed it last year to incorporate both like medical concerns and mental health concerns for children and household members.
I appreciate you adding that. I'm just curious, does that mean it's only for the high needs rated for ERDC, or can anyone that's using ERDC with a child that is having issues in school can use their ERDC hours in a childcare setting so that the school-age child can participate in distance learning?
Yes, so it's not just for high needs. Like as an example, we had a child who was being bullied at school, and the parent was really struggling with working with the school to try and stop that from happening. And so they wanted to pull the child out and put them into distance learning until she could figure out a better solution. So I mean, that's one of the examples that we've seen. I can't say that we've seen a whole lot of examples of this come through. But just to clarify, distance learning is different than homeschooling. So if a parent just wants to homeschool their child, like maybe in the evening and send them to childcare during the day, that's not allowable under this rule. And Annalise.
Okay, I think you gave people some hope where there really isn't hope. The rule doesn't really allow for people to just choose homeschooling, distance learning, right? You can't just say as a parent, I'm going to have my child do distance learning and not go to school, and so they're going to be at daycare all day and daycare is going to get paid, right? I believe the word that is used now is a medical necessity, right? So there are a lot of children out there, and I hear stories every day from providers who are distance learning children because the parents prefer it because they want more of a Christian education, or, blah, blah, blah. It's not, I think we just want to be very careful. And I would encourage folks to go read the rule because it's not opening up distance learning options for kids to be in childcare all day. It is a very narrow rule. If you're going back to exactly what you put in March 2025, it's distance learning for medical reasons, which could include mental health, but not political reasons, not religious reasons, not a lot of the other reasons.
Yes, thank you for clarifying that. And I hadn't planned to really dig into this portion of the rule since we were just restoring things, but I appreciate the questions and the desire to really understand what we're doing here. So thank you all for your participation in this. Making sure I didn't. Okay, yes, I think we answered all the questions there. So for our next rule, this actually is a really exciting change that we have. So this rule, and you'll see one other rule, a couple more down, where we're actually changing the rule so that when a new person comes in and is being added to the case and that person has income, we will now no longer count their income until the family is due for a recertification. So what this has been allowing up until this rule change goes into place is it has been allowing for a family's copay to potentially increase. And this could be if if a second parent moves back into the home and they're working, or a child moves into the home and they're receiving like either disability payments or social security payments or something along those lines, or child support, any of that income could cause the family's copay to increase, and that we're actually out of compliance with our federal funding with this. And so this is in response to working with our federal partners and trying to come into compliance with this rule. So this will be effective March 1st. We'll have that changed in our one eligibility system so that it will stop counting that income. Now, families do still need to report if that second parent's income puts them over the income limits or exit limit for the program, because federally we can't keep cases open once those families go past that exit limit. But this will make a big difference for families when they have someone moving in the middle of their 12-month certification period. Yes, and it stabilizes copays even more. This will be great for providers as well, so that they won't see like unexpected changes to copays during that certification period. Don't think that advanced. There we go. This is another good change for families. So any day now, the federal government should be releasing new federal poverty limits for 2026. What that means is that our initial income limit and our exit limits will be increasing. I'm not really sure by how much yet, but they will be increasing. And then on top of that, our copay tiers are actually set up based on federal poverty limits. So like anyone with their income under 100% of the federal poverty level, their copay is waived. So they have a zero copay. Families with their income at like 100 to 125, it's like a $5 copay. And that's how the copay structure is set up. So when the income or when the federal poverty levels increase, that also increases that line. So there may be some families who like had a $10 copay and now it's a $5 copay, or they had a $5 copay and now it's waived, if their income was just right on that line. So we may see a few families with their copays decrease when this goes into effect. Probably not very many, because they would have to have very very specific income to be able to hit that. But this is overall a good change for families. And then this goes along with the last one that I was just explaining. So this is talking about effective date. So we did have to change in this effective date rule when a copay could increase when someone has moved into the household. So we had to change some of that language to help support that other rule that we just talked about. And then on this rule, there are a couple different things happening with this rule. So this is another one where we inadvertently had some language about outdoor nature-based programs and what pay level they would receive. We had put that in March, and then it was removed in July when we had that version control issue. And so we'll be adding that back in. But another piece that is changing in this rule is that the rates for our license exempt family, friend, and neighbor providers will be increasing effective March 1st. And so we already increased rates for other provider types on January 1st, but it just took us a little bit longer to come to an agreement on the rates for the family, friend, and neighbor providers. If any of you are familiar with the provider types that we have, so we have the family or FAM type, that is our standard family rate. So that's for any family, friend, and neighbor provider who has done our basic eligibility requirements to receive payment. And then we have QFM, which is a qualified family provider. So those are our enhanced rate providers who have done that initial application process, but they've also taken some additional training, and that additional training gets them a little bit higher rate of pay. So the rates for the family, friend, and neighbor providers, those, like, typically rates are determined based on the Oregon Child Care Market Rate Study. But family, friend, and neighbor providers aren't included in that market rate study because typically they don't set rates based on a business model. They tend to set rates based on the relationship that they have with the family or the child that they're providing care for. And most of our family, friend, and neighbor providers are relative care providers. And so what we have done to set the rates for family, friend, and neighbor providers is essentially they are, oopsie, I advanced the slide, I'm sorry. The standard family rate is set at about, if you take the registered family rate and then you take like 90% of that. So that's what the standard family rate is set at. The enhanced family rate is set at 95% of the registered family rate. So these rates will be kind of stepping stones up for hopefully providers to advance in their career. A lot of the trainings that the enhanced rate providers have, they're in alignment with what a registered family provider would need. And so that's it's a way that we've kind of built in stepping stones so that hopefully providers will continue to advance and continue to take more training, and they also receive more pay each time they do that. So we're excited about these changes. We'll have them updated in the system, and we're planning on sending out a mailing to all providers in mid-February. So providers should receive that mailing. We'll make sure to send it out to, I know we've got some of you here, so like 211 info and the CCR&Rs and our early learning hubs, just to make sure we have that information there. And we'll have that rate insert, the newer one, because like I said, we just updated it, but we're updating it again for all providers. So that'll be updated on March 1st. And yes, Annalise, I see your comment that it would be discouraging for registered family providers to find out that family, friend, and neighbor providers are making almost as much as they are. There is a big difference in the number of children that they could care for as well. So the family, friend, and neighbor providers overall aren't making nearly as much. But the training requirements are for enhanced rate versus registered family are fairly close. So enhanced rate providers, I believe they need to, I want to say they need to take 8 hours of ongoing training. They have to have their food handler's card, first aid and CPR certified. I know I'm missing some of them because I wasn't planning on talking about these, but I don't know, Regina or Alma, if you can think of the other requirements for enhanced rate providers. I believe that really a provider would just have to take the introduction to licensing, and I want to say there may be one other training that they would have to take in order to move that up. And I'm hoping everyone else can see the chat, but yes, Annalise is saying that if they care for 3 children and then another 3 children, but they're at different times, they can make nearly as much. And this is actually based on how the family, friend, and neighbor rates have historically been set for quite some time. There was a period of maybe about like 4 years where the rate increases moved away from being based off of the registered family rate. But prior to that, they had always been set as a percentage of the registered family rate. And that was, I mean, that was the intention, is we're hoping to encourage providers to continue to move up and to move into licensing by having those differences. But we also do try to make sure that the enhanced family rates would never be higher than registered family rates. So that's that helps to maintain those tiers. All righty. And so this rule, this does represent a change. And essentially what we're changing in this rule, this is regarding that high needs rate that we had talked about a little bit earlier. And essentially we've been working with Inclusive Partners. So they're another group here at DELC that does the eligibility for the high needs rate. And in reviewing our rule, they called out the fact that they can also use private therapies and behavioral or mental health services as additional ways that a child could qualify for the high needs payments, but we didn't have that in rule. So that was a practice that had been used for quite some time. It just had never been captured in rule. So we're adding this in just to make sure that we have that codified in the rule, and that it does show as like, yes, this is these are valid ways that we can verify that a child can qualify for those high needs payments. And in case any of you are not familiar with it, the high needs payments, it's a supplemental payment that's paid on top of the special needs rate. So the ERDC program, there's a special needs rate that is typically it's the same as the infant rate in each of the areas. That special needs rate is really intended to help open up more options for the family for childcare by paying a higher rate for the child. And then the high needs rate that can go toward, I mean, there are all sorts of expenses that providers can incur. And so this can help them cover additional expenses that may be incurred. Like sometimes there's additional staffing needed or different supplies and things like that. So the high needs rate is a supplemental payment on top of that. All righty. And then I believe this is our last rule that we'll talk about today. This one, again, it has that piece of caretaker relative that we're switching over to caretaker. But the other piece that I really want to call out in this is that we were looking through the rule, and when it comes specifically to a provider who is going into the child's house to provide care, the way the rule was written, it made it sound like everyone in that home where care was being provided needed to be on the CBR, the Central Background Registry, sorry. And that would mean that basically, you know, the child's parents or caretakers or any adult siblings, anyone who lives with them would essentially have to go through that Central Background Registry process, which was never the intention, and that has never been the process of we call them in-home status providers. So when a provider goes into the child's home, since they're really the only new entity there, they're the only one that we've ever required to have a background check done. And so once we realized that language was confusing, we made some changes here to make sure that in those situations, so only the situation where the provider is going into the child's home and the provider has to live somewhere else. So the provider can't be part of that household. But when they go into that home to provide care, they are the only ones required to be on the central background registry. So we're hoping that that will help clarify some of those questions that we started getting around this. I'm just checking. Don't see any questions or hands popping up. So basically, I'll just show you what our, oh, Annalise.
Yeah, I'm just curious, going back to that 90 and 95th% of registered family, what did DELC set, or what did Early Learning Council, Early Learning Council set as the percentage for exempt centers then of CC?
Exempt centers, their methodology has always been a little bit different. So the exempt centers are based off of the certified center rate. And oh goodness.
Right. And
yeah.
it was, as far as I knew, 80%, I think, or
I think enhanced oh goodness. I think enhanced centers are 85% of the certified
Right.
center rate.
Yeah,
and
80,
then
85.
I think standard centers are, so they're license exempt centers. They haven't gone through those additional trainings. They're 75% of the certified center rate.
So I'm just curious if there's any centers, if you talk to any centers to see how they feel about being left in the dust. After, I mean, because at the end of the day, then that doesn't seem like that's very just for exempt centers to be at those much lower percentages when their family child care counterparts are going to be making 90 and 95%.
Well, the certified center rate is one of the highest rates that we have, whereas registered family is the lowest licensed rates that we have. So it's a little bit different, but the certified centers have been, that methodology's been used for as long as I've been in policy. So that's been the last 15 years. And I know with the family, friend, and neighbor providers, it's a little bit different because there is that collective bargaining process that has happened. And so their percentages have kind of changed over the years with each of the negotiations that we've gone through.
Right, they've gone up about 25%. They're getting much higher rates, much higher percentage of RF. No, I'm just saying, and I think that what I said still stands. SEIU bargained 95% of RF for exempt providers. Licensed providers, CCPT bargained this year for us, and we set our rates at market price study. And then we have a second round of increases January 1st of 2027. Well, what I'm saying is that if I was an exempt center, whether I was getting the standard or the enhanced rate, I would feel like I had been slighted. And I think, this goes towards issues of professionalism and respect and, building the industry and the workforce and workforce recognition, all of these issues. And so I was just simply stating that if I had my child in an exempt center, or if I was a worker or owner of an exempt center, I would be concerned that nothing changed for us when everybody else got a bigger slice, so to speak.
Yeah, and I can say that the family, friend, and neighbor rates, when, again, kind of going back to 2011 when I first came to policy, the only thing that's really changed in those percentages is that the standard family rate had been set at 88% of the registered family, and the enhanced rate was set at that 95%. It was like that, like I said, for quite some time until I want to say it was maybe in, Alma, you may remember this, but it was like maybe 2016, where there was just a flat percentage that was negotiated, like a 5% increase across the board. But that concept was getting very messy because some of the enhanced family rates were bumping up against those registered family rates, and those providers couldn't get the same increases. And so it seemed to be much more equitable to base the family, friend, and neighbor rates off of the registered family. That way there was a very clear glide path for the home-based care. And center-based care, I haven't heard any concerns come from exempt centers. I will say we don't have a whole lot of exempt centers that are on our approved provider list.
And let's remember that exempt centers do not have union representation. They're not part of any union.
Yeah. So the process is very
exactly
different.
right.
We've just had a methodology that we've essentially used. And we're open to hearing. I don't know if we have anyone representing centers here today, but we're definitely open to hearing feedback or any concerns that centers may have with those rates. I know we keep an eye out, or keep an ear out, I guess, for situations where we may have providers that are charging a lot of overage. And I can't say that we've seen any evidence of exempt centers having their rates be far higher than what our rates are. But it is very difficult because it's a small pool. And so it's hard to gather that information when there are so few of them that are participating in the subsidy program.
So just Jen, one last time, you said what are the rates? The standard is 80% and the 85% for enhanced?
Oh, for centers?
For the exempt centers, you said they're getting 85%?
Standard is 75, and I want to say that the enhanced is 85. So I think it's 75, 85, and then 100% for the certified centers. I can confirm that and let you know. I'm just going based off of my memory of calculating that out. But I know the standard center is definitely 75% of the enhanced or of the certified center rate. So I'm struggling a little bit with the enhanced center rate to remember exactly what that calculation was.
Yeah, no problem. If you could just have Allison Delory just
yes,
shoot me an email on that just to confirm those numbers, because yeah, thank you.
Absolutely. All righty. So we've got a few important dates, so we want to call out here. These are a little bit out of order, but that's okay. So we're at this mark today having our RAC meeting on the rules. In about 2 weeks, we'll have a presentation to the Early Learning Council, and this is just to review the rules. So this won't be when they actually vote on them. We'll be open for, or we'll have a public hearing on February 2nd. And in that, it'll be kind of a similar setting where people can offer their feedback on the rule set, but we won't be able to have this type of dialogue and conversation. So the public hearing, it's really just listening, but not necessarily dialoguing about the rule changes. And then we're also open for public comment. So if someone doesn't want to come to a meeting, just want to write something out, email it, send it in, that public comment period will be open until February 6th at 5 p.m. And then February 25th, that's when we will give our final presentation to the Early Learning Council, and they'll vote on the rules. And if the rules are passed, then they will, all of these rules are set to take effect March 1st. And I think also just one of the things I forgot to mention, so with the federal poverty limits, we are coordinating with other self-sufficiency programs over at ODHS. So all of us do those changes at the same time. So there will be changes for other income limits and things like that for other self-sufficiency programs as well. Righty, and I believe that is my last slide. I think it's just going to go to a black screen if I try to click this. And it did.
Looks like we have a question maybe from Mercedes. She has her hand up.
Yeah.
Yeah, thank you. So my question was, when would the rule language be made available? So we kind of looked over the general purpose and topics, and are we not actually going to see the language until it's released on that second? You pulled the date, so now I can't say which the date it was, but whenever that one after this meeting was.
That language should have been included with the RAC packet that was sent out. So we sent that out ahead of time.
Yes, it was sent out in the packet. It's the very last in the packets. You got to scroll down a little bit past the initial letterhead, and then there's the presentation that we gave today, and then at the end is the rule language.
And then in that rule
Thank you.
language, so any additions will be, I believe it's underline. I think we're underline and strike through. Is that correct? Or is it bold and strike through?
Some of it's in color and some of it is strike through.
Oh, okay.
Yeah.
Okay. So it sounds like that's in the track changes. So that color just shows any changes that have occurred. But yeah, typically if it's underlined, that's new language being added. If there's a strike through, that's language that's being removed for that. Righty. Oh, thank you. And I see Kathy put the link to the rulemaking page.
Thank you, Kathy. Yeah, I was just about to screen share if it would be helpful for folks if they were wondering where they could also find that on our website, but I do see that Kathy just put that in the chat, so thank you.
And that rulemaking website, so that has all of those important dates on there. It has, I believe, access. I want to say there's information about the like the public hearing and how you can access that, how you can submit like written testimony, and it's just kind of all in one place on that website. Right. So I'm not seeing any other questions. Really just want to thank you all for your participation tonight and taking the time out to go through this with us. We had some really good conversation. And like I said, we've got those two rules that we had where information was inadvertently left out. If you have any questions, you can always reach back out to us, and we'd be happy to discuss. Annalise.
Hey, I don't want to hold us too long, but I just wanted to raise the question that the Early Learning Council, when they voted in December on the RAC from earlier in 2025, held out the exemption change rules. Is that a plan to come back in later this year, or are they just jettisoning the plans on the exemptions?
They felt like there needed to be some legislative action taken first before that rule language was put in place. And so we're essentially just kind of waiting to see what happens during the legislative session. If we do have some statutory change, I feel like I need to back up for those of you. So some of a rule that we had put forward in one of our last sessions was essentially adding in some language that would allow DELC to turn off some of the bypasses to the wait list independently of one another. So right now, the way the rule reads, it's either there's a wait list and there are all of these bypasses, or there's no wait list. And so we were looking to change that because essentially our program is overspent and we have not been given sufficient funding to continue to carry out all of the changes that we've also been mandated to implement in the program. So we're looking at a pretty severe overspend this biennium. And so essentially the way the caseload works is that we have the bypasses to the wait list, and we have families that are leaving the program, but those have remained pretty stable over the last 2 years that the wait list has been in place. So our caseload has really only dropped by about, I don't think it's even a full 200 cases, but about 200 cases from November 2023, when the wait list was first implemented, to now. We cannot sustain the caseload that we currently have. So that was one of the things that we were looking at. We don't have a whole lot of policy levers that we can pull to try and save money in the program. Like we can increase copays a little bit, but we're statutorily mandated to and federally mandated to have them under 7% of the family's income. Even if we did try to increase copays, that would not save as much money as we need to keep the program viable. So hopefully we will hear a lot about our program during this legislative session. We're excited to see what comes forward and really hoping that we'll have some additional funding that may come to support the program. But these are very tough economic times, and we'll see how that goes. All righty. My cursor turns into this big hand, and so if I put it in the wrong spot, I think I see people raising their hand, and you guys are not raising your hands. So anyway, thank you all for participating tonight and for taking the time out of your busy days to join us. And it's been fabulous. So I will give you about 8 minutes back, and I hope you have a wonderful evening.
Jennifer, I do have a question.
Oh, yes.
If we did want to email you a question that is not related to these rules, how do we do that? Or
you can respond back to the RAC invitation that we have. Yeah. I'm trying to think of who sent the RAC invitation out this time. I can also pop my
I think
it was Tara.
Oh,
Tara,
yes. And Tara, she's one of our analysts. She just had a conflict tonight and was not able to participate. So she's a wonderful contact as well. But I can pop my email in the chat too.
Okay.
Will we get an email about the stipend for attending this?
Oh, yeah, that was another question too.
Yes, thank you so much for bringing that up. Yes, we will be sure to get you all an email and information relating to the stipend, likely tomorrow. So please keep an eye out for that. And then it'll include instructions on what you need to do just to submit that. If I know some of you get paid by your organization to be here, if that's the case, you could just respond to our email and say, hey, I don't need this. And for those of you that would like to go through the process, happy to work with you all to make sure that those get submitted.
Thank you so much.
Yeah, of course.